Hello and welcome. I'm Tefera Ghedamu. How best can Ethiopian medical professionals abroad help address the health challenges in this country? My guest today, Dr. Elias Siraj, says medical services and medical education are the two important factors that we need to focus on. In most cases, you are here not to visit friends and family, but to do something that you decided to do that is as part of your initiative at People to People.
Yeah.
Train medical professionals in this country.
Yeah.
Tell me a little bit about that, because I had a few people,
Yeah.
experts, medical professionals from the U.S. on my show over the last few years, and this is, I feel, an extension of that discussion. But yeah.
So basically, for me, I have been outside of Ethiopia for a long time, for more than 20 years, between Germany and United States. So after I finished my training and I started, after I became a specialist, I started thinking, how can I personally give back, help institutions in Ethiopia. So that's how I started coming back over the last 5 years. So I can tell you that there's a lot of,
So you wanted to give back because you've seen the challenges the medical profession faces, not the medical profession, but the sector faces in this country. That's why.
So I think at first I did my medical school in Ethiopia. So I had the advantage of knowing how the medical system actually looks, from my early days of training. So after I started coming back, I realized that there's a lot of areas where we can help.
Tell me about those. How does the sector look like now?
Let me look at it from two perspectives. One is medical services, and the other is medical education. If you look at the medical services, Ethiopia is a very big country, 80 million and more. And if you look at the number of medical doctors in the country, it's very, very small. I don't have the exact numbers, but there was statistics from 2006, which shows that in the public sector, there were only less than 700 doctors in the whole country. There's more doctors, but a lot of them do work outside of the public sector. So that's a very small number. So that shows you already the medical service has a significant lack of manpower. So that brings me actually to the second part, which is the medical education. How can we train more medical doctors and more medical professionals to help the institute? So that's one aspect.
So one feeds on the other. I mean, obviously, the medical facilities in this country are overstretched. We do agree about that.
Yeah.
So what is it that you want to do?
The country has been focused on primary care to improve, rural health in the, small rural communities. And the Ministry of Health has actually received international recognition in that aspect. So things have significantly improved in terms of rural health care. And the other side of it is the hospital care. What about the public hospitals? There are some changes which are being done by the Ministry of Health here in the country. They are changing some of the governance structures of the hospitals. They are changing some of the administrative structures of the hospitals. They are creating additional private wings. So all those are supposed to improve how the public hospitals function. So we would like to be supportive of that. And actually, we think the public hospitals need more support, and the country can do both at the same time.
Have you singled out the specific areas that you support?
From our perspective? Well, I think the key thing is we would like to encourage the country, the Ministry of Health, and the Ministry of Education to do the right policy change so that the public health hospitals also get adequate focus. Once that's done, then from our perspective, we are trying to find ways of linking medical institutions here with medical institutions in other countries. People.
What would that bring?
Okay.
Expertise.
So number one, that will bring expertise. So at individual level, doctors will come here. They stay here for a week, a month, 6 months, a year. And they will practice medicine. At a bigger level, it will bring, bigger teams of people which come here and help not only in taking care of the sick, but also help in creating a very efficient structure, within the hospitals. Third, there will be hospital-to-hospital linkage. There are some hospitals, for some reason, they may be interested in supporting a hospital here. So I think the linkage between hospitals here and hospitals in United States, for example, can be done at different levels. But it usually starts at an individual level. And
so far you have been successful in creating that link with the Black Lion Hospital, right?
Medical education has multiple parts. The first one is the medical education, what we call the undergraduate medical education. The second part is what we call the residency training, which is the specialization. And the third, which sometimes is needed, is what's called the subspecialization treatment, the subspecialization training. So people to people with its members has been trying to help the Addis Ababa University Medical Faculty, which is the Black Lion Hospital, strengthen its residency training programs, open newer residency training programs, and also open new subspecialization or fellowship training programs.
So how many universities from the United States have you brought into the picture in terms of that link?
Yeah. I think it's very difficult to give an exact number in terms of the universities. The involvement is at multiple levels. We have universities who have some type of formal agreement with Addis Ababa University. For example, Wisconsin University, together with Addis Ababa University and People to People, received a grant for starting emergency medicine services at Black Lion Hospital. The place where I work, Temple University, has signed a memorandum of understanding with Addis Ababa University Medical Faculty.
Which particular area is this, endocrinology?
3 areas where we are working is one is endocrinology, where I'm the specialist of. The second area is neurosciences. One of the pathologists at Temple has a research collaboration with pathology department at Addis Ababa University. And we also have an ENT physician who has been coming here to do some surgical procedures. So we have brought together a team, and it's just we are in the early phase, but would like to strengthen that collaboration and bring a lot of help.
So have you seen a difference there?
Well, I mean, these things are.
I'll come back
it's
to
very
slow,
slow.
the challenges are enormous.
Yeah. As I told you, I mean, let's go one by one. I mean, in terms of endocrinology, I have been coming here for the last 3-4 years. We have drafted a curriculum to start endocrinology diabetes subspecialization training program. And we are in the process of discussing with the different stakeholders, including Ministry of Health, Ministry of Education, to figure out how best to start the training program. So it hasn't started yet. But we hope, within 1 year, we'll be able to start the training program.
So would you be able to have, are there professors around who could, teach?
Yeah.
That's always been a very critical element.
Yeah, we have a lot of newer medical schools. And as you know, the medical schools will need teachers. And those teachers have to be usually specialists. With the federal structure in the country, different cities are growing. With the growth in the cities, there is an increasing demand for specialized medical care.
Well, many Ethiopian patients are flying to Bangkok and South Africa, and there definitely is that need for specialists.
Yeah.
That's
and also, if you look at Addis, it's a diplomatic capital of Africa. There's a lot of diplomats. There's a lot of tourists. There's a lot of diaspora who come here. So I think there is a room for focusing on specialist care together with, at the same time, focusing also on the primary care.
So you wanted these professionals, medical professionals who have specialized in one field or another, to stay in the university and be able to teach or go out of the university and provide a service.
Initially, what we are hoping is we will have some diaspora physicians who are willing to come here, maybe for a couple of weeks, maybe for a month. We have also some United States professors who are interested in coming here and teaching. And gradually, what we think is the people whom we train ultimately will be hired either by the Black Lion Hospital here or by the other teaching hospitals in the country, so that the teaching hospitals in the country will have specialized doctors, and they will be also able to start other training programs there.
Is it the right strategy, though, for example, to bring professionals from the US for 2 weeks, for 3 weeks, 4 weeks max?
Yeah,
is that sustainable? Is that the way things should be handled?
I think in the medical field, it's very difficult to bring someone for a long time. Usually the hospitals will not let you come here and at the same time maintain your relationship with them there. So that's a problem. Once in a while, if you are lucky, you will find a retired physician who is willing to come here for a year or for 2 years. But I can tell you it's doable. You don't have to have a physician here for the whole year to start, a specialization or subspecialization. There are doctors here who can train. In endocrinology, they have 2 endocrine specialists here who themselves will participate in the teaching process. They are training another one. Hopefully he will come and join them within a year, so there will be 3 of them. So 3 of them plus some support from outside can be the starting point for starting a training program.
In this area, for example, how many students are you going to enroll?
That hasn't been decided. I think that usually depends on a lot of factors. What's the demand, how many people in terms of the country. Usually fellowship training programs, which are very subspecialized, they take very small number of trainees. It could be 2 initially, it could be 3, it could be 5, and then depending on the demand in the country, and you can increase the number.
So you are spreading out too, to the regional, to the universities in the regions. Tell me about that.
Yeah, so basically, as I was saying earlier, let me just briefly describe how the people-to-people is trying to work with the diaspora. In the United States, we don't know the exact number, but we think there may be doctors in the thousands of Ethiopian origin.
And many of them trained here?
Some of them trained here, some of them trained in Europe, some of them trained in the United States. So, way back, everybody was worried about this brain drain, which still is actually ongoing. But I think a lot of people are thinking now about what some of us call brain gain. So how can we bring back the people who are gone there, who are established there, in a tangible and in a meaningful way? So that's where organizations such as People-to-People come in. So under the People-to-People organization, we have more than 200 actively involved diaspora physicians who either are already helping different health institutions in Ethiopia, or they are in the process of trying to help the different institutions here. In addition to the Ethiopian diaspora physicians, we also have other US and European physicians who are also interested in supporting Ethiopia. So, as I said earlier, over the last few years, one of the focus areas of People-to-People has been how can we support specialization and subspecialization program at Addis Ababa University, which still we are working on. We have done some progress, and there are some challenges we are trying to work through. So recently, what we have recognized is that there's now more than 10 medical schools in Ethiopia, and each medical school is accepting about 300 medical students per year. So what we are realizing is these things are good. This is a huge country. It needs a lot of doctors, and that's the right approach. But what we are trying to focus is how can we help them improve the quality of education. So the numbers are
critical.
Yes. So the numbers are on the right track, but we need some additional quality. So People-to-People is trying to create a formal affiliation with some of the regional universities. With Bahar Dar University, with Gondar University, with Mekelle University, with Awasa University.